So hi everyone, good morning. So for today I'm going to give you a demonstration for the subject cardiovascular system, blood and also pharmacotherapy. So for today I'm going to focusing more on the practical number 4, which is the cardiovascular system of the rats. So we are going to study about the influence of baroreceptor. The second one, going to study about the effect of vagal nerve stimulations by applying some sort of electrical stimulations to the vagus nerve. And then the third one is going to study about the effect of various drugs to the blood pressure of the rats. Okay, and for the first part is going to calibrate the BioPAC system here. So the BioPAC system here already calibrated by using the setting required for the blood pressure monitoring. The second part is going to do the cannulation, which is going to prepare the rats and going to isolate the few things, such as we need to isolate the arterial blood, the jugular veins, we have the carotid artery, we have the vagus nerve, and also we need to isolate the trachea as well. Okay, and then after we preparing the animal, then going to proceed with the methodology, which is we need to study about the effect of vagus nerve stimulation, and also we need to study about the effect of various type of drugs. Okay, so without further ado, going to proceed with the animal preparation.
Okay, so for animal preparation, we're going to start off with tracheal cannulation. So I'm going to make a small incision at the neck area here. So once it's open, you can stretch out and try to locate the neck muscle. The reason we need to do tracheal cannulation is because we want to ease the respiration of the rat. Okay, I have located the jugular vein here, and we need to isolate the surrounding fat layer. Okay, so next is the artery. Going to locate the artery. So artery is actually quite at the back of the trachea. Okay, and usually artery is in line with the vagus nerve. So we have to isolate the nerve first to get the artery. Okay, so artery is a bit stretchable. So once isolated, we're going to put this thread here underneath the artery. And then cut into I'm going to make a loop here so that easier to tie later. And the one at the bottom here, okay, the one on the bottom I'm going to tie. Okay. One end is closed. And before making any incision, we need to block the other end because the artery is where the blood, the whole system of blood circulating. So if we don't block here before we make an incision, there will be a fountain of blood coming out. Okay, so the tube has gone in. Okay, so we need to tie at the end of on top of the tip, on top of the cannula.
So here is a setup for the animal preparations. So here we do have a several part of the animal. So first we have the vagus nerve. So this one is a vagus nerve. So this vagus nerve is used for the electrical stimulations. So for the electrical stimulations, we're going to stimulate the vagus nerve and see for the effect in terms of the blood pressure. Okay, so this one is a vagus nerve. The second one is we call as the carotid artery. So this one is a carotid artery. Okay, so for the left part, for the carotid artery, we're going to use for the occlusion part. That means we're going to see the effect of baroreceptor towards the blood pressure. Okay, and then we also have the jugular vein here. So already doing the cannulation for the jugular veins, and this jugular vein will be connect directly to the tube and will be connect directly to the string here. So inside the string we do have the normal saline. Okay, and then we also need to inject the drugs by using the string here. We have T-valve. Okay, and then we're going to introduce the drug inside the string, and then we're going to see the effect of certain type of drugs towards the blood pressure. Okay, and lastly we have the carotid artery located at the right side. Okay, so the carotid artery we already done with the cannulations, and the tube will be directly into the, we call this one as a pressure transducer. Okay, so for the pressure transducer will be connected to the bypass system here. Okay, so we have a bypass system, and then the monitor here will be translate all kind of changes in terms of the blood pressure. Okay, so now we're going to measure the normal blood pressure for the rats. So first we're going to stop the blood pressure monitoring, and then we're going to change the scale value for the blood pressure from 10 to 1. So you can have the single curve here, a single wave. So from here we need to choose the highest point. Okay, and then we need to click the I bin here, and then we need to highlight starting from the minimum point up to the maximum point. Okay, so from here you can see that the systolic blood pressure for the rat is around 79.63, and also the diastolic blood pressure for the rat is around 41.92. So now we're going to proceed with the first parameter, which is the influence of baroreceptor. So for this method, we're going to clamp the carotid artery for the left side of the carotid artery and see whether there are any changes in terms of blood pressure or not. So we're going to use the crocodile clamp here, this one. Okay, so we're going to clamp the carotid artery. Okay, so first you need to pull out the carotid artery from its place. Okay, and then we need to clamp the carotid artery like that, and from here we need to see the changes of the blood pressure. So you can see that the blood pressure start to dropping down. You can see in terms of the pattern here, and after we remove the crocodile clamp here, you can see that the blood pressure should be returned to the normal. So you can see that here is the effect of the occlusion part for the baroreceptor, and then after a few seconds after we remove the clamp, you can see that the blood pressure is returned to the normal. So now we're going to proceed with the second part, which is the effect of vagal nerve stimulations using the electrical stimulation. So here we already placed the two electrode underneath the vagus nerve, and we already have the plasticine here at the end part of the electrode. Okay, so what you need to do is you need to stimulate the vagus nerve for 10 seconds and see whether any kind of changes in terms of blood pressure. Okay, so when we place the electrode underneath the nerve, And then after we ready, then we can click start to stimulate the nerve for 10 seconds. So we have the on and off button here, so we can click it and simulate the nerve for 10 seconds. So in 1, 2, 3. So what we want to observe is the effect of the electrical stimulations towards the blood pressure. So you can see that the blood pressure is become a little bit lower than the original blood pressure. So now we're going to proceed with the third parameter, which is the effect of various drugs on the blood pressure. So the first drug is going to introduce the acetylcholine, the low dose acetylcholine. So here we have acetylcholine 1 microgram per kg. So how we're going to calculate the volume for the injection is by using the formula. So volume equal to dose, which is we are using the 1 microgram per kg, times by the concentration, times by the weight, which is 0.2 kg of rats divided by the concentrations, which is 1 microgram per ml. Okay, so from the formulation, then we can calculate the volume needed for the injections. So here we have 0.1 ml of acetylcholine, the low dose acetylcholine. So what you need to do is you're going to introduce the drug towards the jugular veins. So we're going to insert the syringe to the T valve. Here we have a T valve, and make sure that it should be inserted correctly, and then the placement for the T valve here should be correct as well. Okay, and then whenever you are ready, then you can pump the drug into the syringe. Okay, and then after that you're going to flush the drugs by using the 0.5 ml of normal saline. The reason why is because there are still a few ml of drug who are stuck inside the tube, so we need to make sure that all the drugs are inserting into the body of the animal. So we're going to flush 0.5 ml of normal saline, and then at the same time you're going to monitor the blood pressure on the screen as well to see is there any kind of changes in terms of blood pressure. So here we can see that the blood pressure is starting to become lower. Okay, so now we're going to proceed with the second drugs. So for the second drugs, we are using the 0.3 microgram per kg of adrenaline. Okay, so we already calculate the volume needed for the injection, which is at 0.12 ml of adrenaline. Okay, so we're going to put the string at the same place. Okay, so whenever you are ready, then we're going to pump the drug into the system, and we're going to use the same method. You need to flush the drugs by using 0.5 ml of normal saline as well, and at the same time you need to see the effect of the blood pressure after we introduce the drug into the system. So next we're going to proceed with 0.1 ml of adrenaline. Okay, so the concentration and the dosage for the drug is 0.3 microgram per kg. Okay, so we're going to introduce the drug into the system. So first we need to place the string inside here, then to slowly pump the drugs into the system. Okay, and then after that we're going to flush the drugs by using 0.5 ml of normal saline. And you need to see the effect of the adrenaline on the blood pressure. Can increase a little. So here you can see that after administration of adrenaline, you can see the pattern for the blood pressure start to increase. So next we're going to proceed with noradrenaline 0.5 microgram per ml. So based on the calculations, we need to inject 0.1 ml of noradrenaline into the system. So we're going to proceed for the injection now. Okay, so you need to slowly inject the NA into the system, followed by 0.5 ml of normal saline. And then at the same time, you need to monitor the screen as well to check whether the blood pressure is increasing or decreasing. So as you can see here, the blood pressure start to increase, a little bit increase compared to the normal blood pressure. So the next drugs, we're going to use the isoprenaline. So the concentration for the isoprenaline is 0.1 microgram per ml, and the dosage that we use is 0.1 microgram per kg. Okay, so as usual, we're going to inject through the string here. And then followed by 0.5 ml of normal saline. So as you can see from the monitor here, after the injection of isoprenaline, 0.1 microgram per kg of isoprenaline, you can see that the blood pressure is slightly increased compared to the normal. So next we're going to proceed with the nicotine. So the concentration for the nicotine that we're going to use today is 100 microgram per ml, and then the dosage for the injection is 50 microgram per ml, 50 microgram per kg, sorry. So before that, I'm going to insert the string into the place. And then we're going to inject 0.1 ml of nicotine into the system. Okay, followed by 0.5 ml of normal saline. Okay, and as usual, we need to monitor the blood pressure through the screen. So after the injection of nicotine, 0.1 microgram per kg of nicotine, you can see that the blood pressure is slightly increased compared to the normal blood pressure. So now we're going to proceed with the atropine. So the concentration for atropine is 1 mg per ml, and then the dosage for the injection is 2.5 mg per kg. So based on that, we need to inject the rest by using two methods. The first method is going to inject through the IV, and then we're going to inject through the IP as well. So we're going to divide the total volume by 2. So first we're going to inject the atropine, 0.25 ml of atropine through the IP, which is around here. Okay, so we're going to proceed with the injection in this area. Okay, so after that, we're going to proceed with the injection of atropine, 0.25 ml of atropine through the IV. And then followed by 0.5 ml of normal saline for the flushing. And then after injections, we need to monitor the blood pressure on the monitor of the PC. So as we can see here, after the pre-treatment with atropine, you can see that the blood pressure is slightly increased compared to the normal blood pressure. So while the effect of atropine is still in the system, next we're going to proceed with the pre-treatment of ACH, the low dose ACH, which is 0.5 microgram per kg of ACH through the system. Okay, and then proceed with 0.5 ml of normal saline. So we can see that the blood pressure for the rats after the pre-treatment of ACH is like nothing changes in the term of blood pressure, because we already inject with the atropine before. So next we're going to proceed with the vagus nerve stimulations after the pre-treatment of low dose ACH. So we can click the on button here. I'm going to stimulate the vagus nerve for 10 seconds. So in 1, 2, 3. So at the same time, you need to monitor the changes in the blood pressure during the stimulation. 1, 2, 3, stop. So as we can see here from the graph, after the vagus nerve stimulations, you can see that the graph or the blood pressure is slowly or slightly decreased and then coming back to normal after a few seconds. So now we're going to proceed by using the acetylcholine, but this time we're going to use the high dose injection. So the concentration for the acetylcholine is 1 mg per ml, and the dose for the injection is 1 mg per kg. So based on the calculation, we need to inject 0.2 ml of acetylcholine into the system. So after the injection of acetylcholine, need to inject the 0.5 ml of normal saline as well. And then after the injection, we need to check the blood pressure, whether it's increasing or decreasing. So after the injection of 1 mg per kg of acetylcholine, you can see that there's no changes in terms of blood pressure happen, because the atropine already block the activity of acetylcholine. So next we're going to proceed with the hexamethonium. So the concentration that we use is 1 mg per ml, and then the dose for injection is we are using 2.5 mg per kg of hexamethonium. So based on the calculations, we need to do the injection using two types of injections, which is 0.25 ml through the IV and also 0.25 ml through the IP. So we're going to proceed with the intraperitoneal injection. And followed by the intravenous injection of hexamethonium. And then we need to flush the system by using 0.5 ml of normal saline. Okay. So after the injection of hexamethonium, you can see that the blood pressure is slightly decreased compared to the normal. So this is the normal blood pressure, and this one is the injection of hexamethonium, and this one is a result of the injection, which is you can see that the blood pressure is slightly decreased compared to the normal. Okay. Kat ni itu dulu. So next we're going to proceed with the post-treatment by using the nicotine. So we're going to use the 50 microgram per kg of nicotine to study the effect of nicotine after the injection of hexametonium. So now we're going to proceed by injecting 0.1 ml of nicotine into the system. Okay, so followed by 0.5 ml of normal saline. So after the post-treatment of nicotine, you can see that there are no changes in terms of blood pressure. So next we're going to proceed with the administration of acetylcholine, the high dose acetylcholine, which is 1 mg per kg after the post-treatment using the hexametonium. So we're going to inject 0.2 ml of acetylcholine, high dose acetylcholine, into the system. Then followed by 0.5 ml of normal saline into the system. So after the injection of 1 mg per kg of acetylcholine, you can see that there are no changes in terms of blood pressure. Tak nampak. Ada naik ke? So after the injection of 1 mg per kg of acetylcholine, the high dose acetylcholine, you can see that they are slightly increased in terms of blood pressure after the injection when we compare to the normal blood pressure. So here is a normal blood pressure, and we can see that they are slightly increased in terms of the blood pressure after the injection of acetylcholine. So next we're going to proceed with the pentolamine, the pre-treatment with pentolamine. So the concentration for the pentolamine is 1 microgram per ml, and then the dosage that we need to use is 0.5 microgram per kg. Okay, so we're going to proceed by injecting 0.1 ml of pentolamine into the system. So after the administration of pentolamine into the system, you can see that there is no changes in terms of blood pressure after the administration of pentolamine. And after this, we're going to proceed with the another post-treatment by using the acetylcholine, adrenaline, noradrenaline, and also nicotine. So now we're going to proceed with the post-treatment by using the acetylcholine. So we're going to use the low dose acetylcholine, 0.5 microgram per kg. So we're going to inject the acetylcholine into the system to see the effect of acetylcholine after the pre-treatment by using the pentolamine. Okay. And then we're going to proceed with 0.5 ml of normal saline as well. So after we do the post-treatment by using the acetylcholine, 0.5 microgram per kg of acetylcholine, you can see that there are no changes happen in the blood pressure of the rats. So now we're going to proceed with the adrenaline. So we are using the concentration for the adrenaline is 0.5 microgram per ml, and the dosage for the injection is 0.3 microgram per kg. And we're going to see the effect of adrenaline after the pre-treatment by using the pentolamine. Okay, so first we're going to inject by using the adrenaline to inject into the system. and then the same thing followed by 0.5 ml of normal saline. Okay. So you can see that after the injection of adrenaline, the blood pressure become little bit increased. You can see that it's a little bit increased here. Increase tremendously because the phentolamine unable to block the activity of adrenaline. Next, we're going to proceed with the post-treatment by using the NA, noradrenaline. Okay, so we are using 0.3 microgram per kg, the dosage for the NA. So we're going to inject NA into the system, followed by 0.5 ml of normal saline. So after the post-treatment by using the NA, noradrenaline, you can see that there are slightly changes in terms of blood pressure. So the blood pressure is keep increasing when compared to the normal blood pressure. And last but not least, we're going to inject 0.1 ml of nicotine. So the concentration for the nicotine here is 0.100 microgram per ml of nicotine, and the dosage is 50 microgram per kg. So we're going to inject 0.1 ml of nicotine into the system, followed by 0.5 ml of normal saline. Okay, so after the injection, we can see the changes in terms of blood pressure after the administration of nicotine into the system. Zoom macam tu. So this is the result after the administration of nicotine. So you can see that there are two different changes. We have this one is a normal blood pressure, and then this one is after the injection of nicotine. So you can see that after the injection of nicotine, the blood pressure is slightly increased compared to the normal.